I am an optimist, and I am so excited about the medical profession, the hospital profession, because of the good we do, because we can look ourselves in the mirror and know how many people we help each and every day, directly and indirectly, and every person. I initially thought I wanted to be a veterinarian. I love animals. We have 3 dogs now, for several years actually a vet, but decided I wanted patients who could actually talk to me, tell me what was going on, and ultimately became a primary care physician where I really love that longitudinal relationship and knowing people for a long period of time. And I still see some patients today, a very small number, but I do have a practice of about 100, 120 patients that I see. And of course, 99.99% of my time ends up administratively now. Being on the administrative side has enabled me to really help make decisions and help other people make decisions that impact many, many more people. I see myself as very much of a coach, just like a baseball coach who may have been a former pitcher, but was never a catcher and was never a first baseman. They've got to be able to do that and to bring out the best in people. So it's about finding and motivating the right people, connecting them to the passion and purpose of what we do, and then really enabling them to be successful. What I'm most passionate about is safety and quality and service. We have a saying at Houston Methodist, unparalleled safety, quality, service, and innovation, and it is in that order very much on purpose. Because our patients don't want to choose between safety, quality, service, or innovation. They want, they demand, and they deserve all of those things. And that's our sacred responsibility as healthcare leaders. If there were ever anything I'm most proud of, it's how we've moved the needle on safety and quality, because that's why we're all in this at the end of the day. And I'm a huge believer if you focus on those fundamentals, the rest follows. Affordability is there with a safety, a quality, a service, and innovation. It is something we all must focus on. We have to look at how we are efficient, how we utilize our resources very well. We have to look at how insurance structure is in the United States. When I think of the future, there's many levels of excitement. Some of the medical innovation and pharmaceutical innovation have incredible promise to really improve the human condition. I have no doubt that we can enhance the care that's provided, enhance the safety that's provided. When you think about artificial intelligence, when you think about many of the digital aids that will be there, we're going to see a transformation of the practice and delivery of medicine. That's why we've pushed that so hard at Houston Methodist, and I think our field needs to push that dramatically to face many of the challenges coming, whether they're cost challenges, safety and quality challenges, staffing challenges that we know we will face. I'm very optimistic about 2026. There'll be bumps along the road, there'll be challenges, there'll be things we have to deal with in DC, there'll be things you deal with in your state houses, there'll be things you deal with other unexpected challenges, whether natural disasters or pandemics or many other things. It's all part and parcel of what we do. But when we stay grounded and focused on the meaningful, we'll sort out the more difficult that comes along the way. And when we have field unity and when we all have a common purpose, which we do, as we all work for the same common goal, which is better care for humankind, better care for people in the United States.